Hello everyone! So it's going to be our second topic for the final term for our Nursing Informatics lecture. And for today's session, we will discuss the topic related to your Nursing Informatics and your leadership. Without further ado, let's start with this topic. Now, as nurses, we try to ask ourselves sometimes with these questions. What does it mean to be a leader? What are the qualities of being a good leader? And sometimes, what are those roles or priorities you have to do when you take on a leadership role? As nurses in the field of informatics, we try to tend to role or to take the role of a leader, especially if it will benefit our patient care. Now, let's try to discuss the successful traits that a leader should have. Number one, a leader should be or should have self-awareness and puts importance on personal development. We tend to improve not just for ourselves, but to help also others, especially in our patient care. Number two, we focused on helping others. Ika nga nila, empathic rather than sympathetic. Okay? Or sympathetic. Number three, we have your confidence among yourselves and in your fellow nurses and your skills. Number four, you hone your own communication skills and the communication skills of your co-nurses. And oftentimes, your leaders lead by example. Okay? What you see with your leader, sometimes you tend to incorporate it with your personal characteristics. Okay? Kung sometimes, di ba, makitaan mo kung ang imo nga leader, permi lang akig, dugay-dugay ikaw akig man. Okay? You try to adapt with those characteristics. So as leaders, we have to act accordingly and make sure that we act as if that we are being followed by our coworkers. Because again, leaders should lead by example. Next, your leader is able to make tough decisions. Especially in the medical field, we tend to decide for our patients' welfare. Okay? We contribute with the patient's welfare. Okay? Kung ano ang kamayuhan para sa pasyente, we are trying to help in the best way possible. Leaders also are ethical and civic-minded. We try to follow the rules and regulations within the hospitals and the oath that you have taken up when you were a professional nurse or you start to become a professional nurse. Also, your leaders class are responsible and dependable. And usually they have their goals and are patient and tenacious when it comes to reaching your said goals. So these are usually present in a successful and in a good nurse leader. Now, let's have the essential informatics competencies for nurse leader. Kung ikaw mangin leader, especially with the field of nursing informatics, you must have the following competencies. Number one, the mastery of basic computer competencies. Nurses need basic computer skills to assist your patients. You have to focus on the following. Number one, the concepts of your ICT of your information and communication technology. Kabalo ka dapat magamit sang technology, basic applications, basic software. Also, you have to use your computers and managing the files. One of the basic computer competency or the mastery of your basic computer usage is you are able to use your word processing and your spreadsheet applications. Also, you're knowledgeable with making of your presentations. And lastly, the basic competency of web browsing and basic communication. So, dapat as nurses or nurse informaticists in the future, dapat kabalo ka mo sang basic computer usage. Number two, you must have your comprehension of your information literacy. When we talk about your information literacy class, it is your ability to recognize your information and is needed and to be able to locate, evaluate, and use your information as necessary. So usually class, when we deal with your comprehension with your information literacy, you focus on the following areas. Number one, you determine the nature and the amount of information needed. This information should be essential lang dapat. Not all information nga ginakuha ta sa aton nga patient are vital. So you take your important information that is necessary for the patient care. Number two, you have to access the information quickly and efficiently. Number three, we try to evaluate the information and the sources. And number four, you use your information for specific purposes. And lastly, class, we try to assess the value of your information used. Okay, as nurses, sometimes we tend to ask the assessments information or basic information from the patient. Make sure that you are literate when it comes to gathering your data. These data are confidential and sometimes need to be kept for patient safety. Okay? Next. As an informatics nurse, you must have the competency in understanding your information management literacy. Okay? When we deal about your information management class, these are your process of collecting, processing, presenting, and communicating your data as knowledge or information. So when you are knowledgeable with your information management, you tend to focus on understanding and verbalizing the importance of various types of health information systems used to manage your healthcare data in the clinical practice. Kabalo ka mo sang imo nga ginagamit dira nga information systems. Like for example, kabalo ka magamit sang imo nga BizBox, or let's just say other softwares or applications nga ginagamit sa inyo nga institution. You also use your due care to protect your patient privacy and the security of your health information systems. And lastly, class, you understand the principles, policies, and your procedure that health information systems use to manage your data. Remember, class, according to your 13 patients' rights, di ba may mga patient rights kita? Our patient has the right to privacy and your confidentiality. So the moment the patient will step into our hospital or your healthcare facility, they are entitled to privacy. Okay? Again, your patient is entitled of your privacy. So your hospital records class becomes the responsibility of the hospitals and your responsibility as part of the healthcare team. Okay? The hospital will hire usually your programmers or your nurse informaticists to set up your protection on the patient's information by setting up your firewalls, your antivirus, or your encryption technology. Okay, dapat kabaluman kita sa mga ginagamit ng mga firewall or mga antivirus ng mga software. This is to secure your patient data. Remember, class, that when something or any data that is encrypted, it means that you can only access the information if you have the password or an access code. Okay? So, dapat kabalo kita magamit sang aton nga security settings. Now, let's try to have the relationship of your nursing and in the field of your informatics. So, as nurses, we collect information about our clients. Using your data or using these data to develop your nursing care plans, we implement the plan and communicate our findings with other healthcare providers, especially as nurses, di ba nagahimo kita sang aton nga NCP. So advances in the ICT or information technology allows your nurses and your nursing students to access your vital information with the click of a button. Like for example, in your hospitals or sa inyong mga clinics nga ginaobrahan, healthcare providers have the access to your electronic medical record or your EHR or EMR, which provides the access to private and confidential client health information in a secured environment. So services such as your telehealth provide a means for client education, as well as medical and healthcare services such as your health monitoring or clinical diagnosis. So social media is also being used sometimes in healthcare to provide a means for clients to share their experiences with one another or learn more about their medical condition. So kumbaga, atong mga pasyente nag-search dira, or sometimes they are using their social media to communicate with the healthcare team or healthcare members. Now, more than ever, nurses have the opportunity to communicate and plan care more effectively. Mas hapos ang communication with the use of your technology and in collaboration with the clients and other healthcare providers due to the advancements in your technology. Mas hapos na lang siya. Now, remember class that as leaders or nursing leaders, you are required to merge your own idealistic expectations of being a strong leader with the challenges of a practice environment in a constant state of technological evolution. Okay? Kumbaga, ang change in the usage of technology is non-stop. Every time, every month, or every week, sometimes there are updates, there are changes or advancements that usually occur. So, tandaan ta class, as nurse leaders, require a variety of unique skills, including the knowledge of informatics, to support the delivery of safe and effective patient care. According to the Canadian Nurses Informatics Association class in year 2017, they said that it is essential for all nurses to develop your informatics competencies. That is why here in the Philippines, as early as your BSN era, we are trying to educate you with the basic foundations of informatics. Because in the field of informatics, sometimes we tend to be leaders in dealing with handling your technology. Also, class, strong leadership in nursing requires developing a plethora of skills encompassing your clinical knowledge, your interpersonal communication, systems thinking, adaptability, collaboration, quality assurance, and your human resource management. So this technological evolution class, magambal kita, technological evolution or changes in the usage or upgrades in the technological use rather, it encompasses a wide variety of information and communication technologies, such as email communication or mag-email kita between your healthcare team, and the development or deployment of your new bedside monitoring equipment, or let's just say the design or the implementation of your new EHR or EMR in the hospital setting. Now, the role of a nursing leader encompasses clinical and managerial responsibilities that may vary depending on clinical setting or placements in the organizational hierarchy. Lain ang pag-manage mo kung kisa sa isa ka department. Kung kamo mangin nurse head or nurse managers in the near future, gavari ang aton nga leadership styles or way of managing things in specific areas and based on the attitudes of your fellow nurses. So in looking at nursing leadership literature, Through the context of your informatics, it is apparent that leaders are pivotal to technology integration in every area or arena of nursing practice. Okay, especially if you are leaders with the knowledge, with the usage of your informatics. Healthcare's continuous state of transformation now requires your nursing leaders to develop your informatics skills and competencies. Dapat kabalo sa informatics, kabalo sa skills, kabalo sa competencies. It is no longer optional if one wants to lead effectively in technological age. So, mapabata ka man or mapa-elderly, you must have the competency or the knowledge with nursing informatics. As nursing leaders who develops your informatics competencies can work more effectively in ensuring the successful selection, the development, and competent use of your devices and your clinical systems. Dapat kabalugid ka mo. Additionally, your nurse leaders with informatics competencies and knowledge will be needed at higher levels to inform the policy and the decision-making related to ICT implementation. Now, nurse leaders kuno class are also positioned to provide a holistic perspective when the organizations move to develop integrated models of care that leverage technology, such as telehealth, to transform patient care delivery. Okay? So, intertwining or combining or within the usage of your technology kag ang application sa aton nursing practice class creates an interdependency that, when leveraged properly by nursing leaders, can create your project synergy and bolster their ability to advocate your ICT solutions that meet patient needs and yield sustainable quality patient outcomes. Kung kabalo ikaw, mag-nursing care, mag-provide care sa imo nga patient, kag kung kabalo ka mag-use sang imo nga own technologies, it will be effective katama. There is interdependency, there is collaboration within the usage of technology and your nursing practice. Dapat naga-intertwine na sila, naga-combine, naga-bulos-bulos. Okay? Nagabuligay katama. So to put it simple class, your leaders who developed and adapt the usage of your informatics competency can help bridge the gap between clinical nursing practice and IT. Okay? So, kung ikaw ang leader sa inyong ward, kung ikaw ang nurse manager or ang head nurse, dapat ikaw ang naga-provide knowledge and connection sa imong staff nurses. Na dapat ikaw maga-integrate sang technology nga sila makabaluman sa ulihi. Okay? As nursing leaders, again, you try to influence and give or sustain knowledge within your healthcare team. Okay? Next, nursing leaders with informatics expertise can leverage data to identify patterns and correlations in the delivery of your nursing care, potentially identifying areas to target for quality improvement. For example, nanging head nurse ikaw sa isa ka area. Let's just say you are the head nurse in the emergency room or operating room. Dapat ikaw, you are able to practice the usage of your technology, and this technology, you try to monitor if effective bala siya sa inyong ward, and how or in what way or terms you can suggest that you will be able to improve these specific apps or technology for your patient care. Okay? So, nursing leaders need to be aware of and skilled at using your big data to advance your nursing practice. Currently, class, your nursing is considered as the single largest user of health informatics technology. Compared with other fields, no? Your nurses are considered as the largest user of health informatics. Yet, the profession receives little information back that can be used to inform practice. Especially nowadays, here in the Philippines, do tayo lang gidya ang knowledgeable with the use of your technology. May ara kita technology tod sa mga hospitals, pero limited katama. Kumbaga, hindi siya naton ma-align sa standards sa international community of healthcare. Okay? For nursing class, the utilization of your data provides an opportunity to generate a deeper understanding of your impact for nursing care. Ayan. So, dapat gali class, kabalo ka mo magamit sang inyong technology. Hopefully, when you have your exposures in the hospital, your instructors will also orient you with the usage of your BizBox or simply with your HIS or Health Information System dito. Para at least as early as now, you are exposed on how to navigate those applications and might as well consider having those applications na ginagamit man sang other institution. Kumbaga may early practice, early usage, samtang students pa lang kamo. Now, let's try to have this example on data system specific to your nursing practice. Here, we have your CHOBIC or your Canadian Health Outcomes for Better Information and Care. Okay, dito sa Canada may amo ni sila ya. So, these are your set designed for use across the domains of home care, acute care, long-term care, and complex care nursing practice settings. Kumbaga, unified iisa ang ilang ginagamit nga standards or systems or data systems rather sa nursing practice nila. So it can provide nursing leaders with the pragmatic ability to leverage clinical data from admission and discharge for the purpose of assessing the quality of care delivery, informing your innovative health system design, and driving your policy development in healthcare. So sa ilaya may ara sila ginatawag nga CHOBIC or Canadian Health Outcomes for Better Information and Care. So here class, knowing that in other countries they have this specific data systems, now we know class that there is a gap, however, between the informatics skills required of nursing leaders and the availability of formal training and education to develop your informatics competencies. Especially now, no, nga may pandemic or through online learning, sometimes we tend to forget on how to properly have enough training for the hands-on with or hands-on skills with the usage of specific IS or your information systems in the hospital or even in the communities. So the current literature clearly demonstrates that there is a definitive role for nursing leaders that demands the development of informatics knowledge and skills to advance your nursing practice and transform your healthcare. Your nurse leaders class describes the developing informatics competencies as a result of on-the-job training. So, dapat samtang naga-duty pa lang kuno may competency na kamo with the use of your informatics. So, the lack of formalized training was broadly seen by study participants as inadequate to meet their skill development needs as leaders. So, kumbaga na-study nila before, na-notice nila nga there is lack of skill development. Okay. That results to a continued marginalization of nursing if the profession is limited in starting your informed discourse in technology-dependent healthcare environments. Like for example, subong in times of pandemic, wala ka mo ka-duty, wala exposure. So there is a limitation with the acquirement of or acquiring your knowledge with the usage of technology. So under the theme of your nursing leadership role in healthcare informatics class, it was identified that your informatics competency development is recommended to support effective leadership in today's healthcare environments. Anami gani class, kaysa inyo generation, as early as now, kabalo ka mo isang basics of computer usage, even the basic applications sa computer use. Compared with those nga ara subong sa current hospital settings, especially that there are generational gaps nga ginatawag. Some are knowledgeable, but some also are not knowledgeable with technological use. Okay? Nursing leaders who develop and adopt informatics competencies are needed to inform your policy and decision making by bridging the gap between IT and clinical practice. Okay, dapat sa isa ka hospital setup, dapat may mga trainings kita, may follow-up trainings. Kaya para hindi lang sa isa ka ward, isa lang ang kabalo magamit computer. Dapat tanan, amat-amat makabalo magamit sang computer, magamit sang applications present on your institution. So if leaders fail to develop your informatics skill and integrate them with their clinical knowledge, the impact will be felt at the point of care with the implementation of fragmented systems that misalign with nursing workflows. Okay? Let's just say, for example, kung na-hire ka as a nurse on the admitting section to provide assessments, kag kung ikaw hindi kita kabalo magbutang information sa inyong application, chances are there can be lack of information provision, or let's just say lain da ang na-save nimo nga information or kulang ang na-save nimo nga information, it will ruin your patient care. Kung kisame makulang lang da, no, let's just say wala mo binabutang ang chief complaint or wala mo da na encode ang mga previous diagnosis ng aton patient. So what happens? There is kumbaga lack of the implementation of proper studying or proper implementation of technological use. There is misalignment nga ginatawag. Kumbaga ang imo nga nursing workflow, ang pag-provide nimo sang nursing care gaka-alter because sa technology use pa lang hindi na kamo kabalo. Okay? So as nursing leaders need to develop your informatics competencies to drive professional interoperability, ensure nursing data is leveraged to inform your decision making and provide patients with efficient, safe, and innovative care. Okay? Now, as a nurse leader class, it is important that you have your goals set to your staff or to your office. Let's just say, for example, naging leader kamo dira or manager sa inyong ward. Dapat may ginaset kamo dira class nga goals. So your goals may arise from either organizational readiness. Kung ano bala ka ready ang inyo nga team sa paggamit sang technology. Number 2, there might be an advancement of a service learning culture. Dapat as early as possible, ga-engage na kamo sa service learning culture. Okay? Dapat, if there are updates, naga-engage kamo nga i-learn nyo na kung ano na siya nga update. And also, class, there must be a goal that arise from the benefits for the healthcare system and professional growth. Okay? Benefits for the healthcare system and professional growth. That is why may ginatawag kita class nga technological adaptation. Okay? Naga-adapt kita dapat sa changes sa society. Like for example, your chameleon. Kung ara siya sa color blue nga kortina, gaano siya? Ga-transforman siya color blue. Kung kamo naglakat kamo sa Dubai nga ang ila information system didto is complex, dapat ikaw kabalo ka man mag-learn sang technological usage nga complex man didto sa ilang areas. So when we talk about your technological adaptation, this is a sociological model that describes the adoption or acceptance of a new product or innovation. Okay? Change is dynamic, ever-changing, kumbaga. And in nursing practice, it is considered as dynamic. So for example, may mga updates sa technology use, dapat ikaw kabalo ka man sa updates on technology use. Because as you can see, due to the generational gap, laban mga pamatanon, amo pa kung kisang gaubra sa mga computer nga mga roles or computer or technological roles sa hospital. Okay? So dapat kabalo kita mag-adapt with these changes. Now, let's have class your different leadership styles that you can use in a hospital or in any settings of healthcare. Maghambal kita class leadership style. It refers to a leader's methods and behaviors when directing, motivating, and managing others. So a person's leadership style also determines how they strategize and implement plans while accounting for the expectations of stakeholders and the well-being of their team. So kita class, may kanya-kanya kita nga ginatawag nga leadership style. Okay? And it is important nga dapat kabaluman kamo sang inyo nga own leadership style. Now, why is it important to know your leadership style? Knowing class your leadership style is critical because it can help you determine how you affect those who are under your direct influence. So it's always important to ask for feedback to understand how you're doing, but knowing your leadership style prior to asking for feedback can be a helpful starting point. Knowing your leadership style may also remove the need for getting feedback. And each leadership style class has its pitfalls. Hindi tanan nga leadership style nami lang na siya. May ara gid iba nga negative connotation or pitfalls that allows you to proactively remediate areas for improvement. Okay? Now, let's discuss these different types of your leadership styles for a while, class. Okay. Let's have first your democratic leadership style. From the word democratic or democracy, there is equal freedom. Okay? So in your democratic leadership class, it is commonly effective wherein your leader makes the decision based on the input of each team member. Although the leader will be the one to make the final call, everyone has an equal say on the decision. It is effective since it allows lower-level employees to exercise authority. Let's just say, for example, kung ako ang nurse manager sa hospital, mangkuton ta kamo anay. Okay bala sa inyo nga gamiton ta si Bizbox? Nga gusto nyo or nga hindi nyo gusto, explain nyo bisa akon nga Okay, there is 50-50 nga ginatawag nga decision making. Ga-decide si leader pero naga-decide man ang inyong nga team. Kumbaga, ga-plan out kamo in a unified decision. Isa lang ka decision. Nagabuligay kamo decide what is best for the team. Okay? We also have class your autocratic leadership style. So this one class is rarely effective. So it is the inverse of your democratic leadership. Kung sa democratic may freedom kamo or equal freedom, in this leadership style, the leader makes decisions without taking input from anyone who reports to them. So no one is considered or consulted prior to a change in the direction, and those who are working under this type of leader are expected for adhere to the decision made by the leader. kumbaga, kagina sa democratic 50-50 decision, diriya 100-0. Tanan nga decision kay leader. We also have class your laissez-faire leadership. Okay, from the word itself, laissez-faire. Okay? Ang iban kung isa magamag kita laissez-faire no kabahala, na basta amo na siya. Amo na lang siya. Man. In your laissez-faire leadership, it is sometimes considered as effective. Laissez-faire directly translates to let them do. Kamuda bahala. Bahala na system. And leaders who have this type of leadership style afford nearly all authority to their employee. Kagina 50-50 sa democratic, sa imo nga autocratic 100-0. Diri naman sa laissez-faire laban-laban 0 to 100 or 25-75%. 25% si leader naga kumbaga confident na lang siya sa iya nga mga members. 75% of the effort or the decisions are coming from the team or the members or the subordinates. Although laissez-faire leadership can empower your employees, kaya syempre ginapabayan mo sila mo nga kamo desisyon, kamo na bahala. No? So, it can limit your development and overlook critical company growth opportunities. Therefore, it is important that this leadership style is kept in check. Kaluoy, man bikong kisa nga pabayaan mo da imo nga subordinates or ang mga under sa imo nga sila lang gamato-mato, tapos ikaw yung leader gahayahay, paglabot na sa obrahanay, kag nagkinagamo, ikaw nga leader ang palak-palak, kay nagsalig katutanan sa imo nga subordinates. Yan. So that is your laissez-faire. And lastly, we have your strategic leadership. Strategic leadership, it is commonly effective. So the leader accepts the burden of executive interest while ensuring that current working conditions remain stable for everyone else. Kumbaga, mas balanse gini siya sa strategic leadership. Ginaplanuhan gidya, not just only by the member but the entire team. So this leadership supports multiple types of employees at once. However, leaders who operate this way can set a dangerous precedent with respect to how many people they can support at one and what the best direction for the company really is if everyone is getting their way at all times. Kumbaga, in your strategic leadership, dapat na planuhan, na id-id, na inform each member in this kind of this leadership. Kaya para there is equal relay of information, equal roles, equal, kumbaga ang ilang nga gina-play nga role sa isa ka team, and thus your leadership is strategized. From the word itself, strategic, na planuhan gid kumbaga, na plastar gid kumbaga. However, kung sala ang pagplastar, kung kisa it leads to problems within the healthcare team. Okay? So that is why as students, you must have the knowledge in the use of your informatics, because in the near future, some of you might become leaders, but as of now, di ba, gina-develop na kamo as leaders, or you considered yourself already as leaders, but in the reality of nursing profession class, when you have the opportunity to become leaders, especially sa hospital or in your chosen profession sa ulihi, for example, nag-work ka mo on a community setting, there are chances that you have to decide in which leadership roles you have to play. And this leadership role that you play in your specific team will determine your readiness and acceptance with the use of your technology in this changing times. Because again, like what I've said earlier, nursing is dynamic. It is ever changing. Okay? So that ends our discussion on your nursing informatics and leadership. Ayan. Now, Let me get back to you on our live synchronous class for your queries regarding the said topic, and will give you some of your activities and instructions for the coming weeks. Okay? So let me get back to you on our live synchronous class.